one of the areas that we often hear questions relating to are relating to pain and mechanisms of pain. But the subject of this mini lecture is about pain and the brain. Instead of talking about how does the brain create pain, how does the brain in terms of circuitry and pathways drive the sensation of pain, we're going to talk about what does pain do to the brain. One of the first things that we need to talk about is the concept that when we have pain, the first system that's going to automatically be affected is the pain system itself, and in the terms of overdriving certain areas of the brain, which causes a decrease in activity and activation in other areas of the central nervous system. As we have an increase in pain, we lose what's called proprioception, which is where am I in space? Where is my arm compared to the rest of my body? Where is my leg? And losing that proprioception over the long haul is going to create an even bigger problem. We'll be discussing that in other lectures, and other mini lectures. But in this case, any effect that we have from the periphery is going to have an impact on the brain, on the central nervous system itself, and on the brain. Anytime we have a problem within the brain, it is going to be made manifest in the rest of the body. So if I have an effect on the brain that I'm creating over time with pain, and it affects my ability to know where I am in space, that's going to affect my brain's ability to control my body. And those are the pathways and circuitry that I use not only for walking and moving, but I use them for thinking, which means my thinking is going to be degraded. My entire systems relating to the autonomics that cause those to happen are going to become dysregulated. So the ability to get blood flow, to do digestion, to function sleep, to get productive sleep patterns, all these things are going to be disrupted because of the presence of pain. And so getting rid of pain is smart. We got plenty of people who say, well, I was waiting, I was hoping it'd go away, or I was just toughing it out, and it's 10 years later, and now they're barely able to walk or move or think, and that. And the patients that we see in this office, many times they come into this office and they're on the edge of suicide. They're saying, I've been to 10 doctors, I've been to 5 chiropractors. If you can't fix me, I'm going to blow my brains out. Those kind of patients, had we solved the problem 15 years ago, we wouldn't have ever gotten here. So, very interesting study done in the Feinberg School of Medicine, Northwestern University, Chicago, Illinois, and its summary in the conclusions with relation to, they did theirs relating to chronic back pain, and they did PET scans relating to back pain and its effects on the brain. It says chronic back pain patients exhibit an increased deactivation of key elements of the default mode network. Chronic back pain patients exhibit a dramatic alteration on the default agonist-antagonist balance. So we're losing that ability to know where we are in space, to have control of those systems, to be able to inhibit our own pain. We use that often to inhibit our own pain and to dial down sensations. As a result of a decrease in total area and function of anti-corrections together with an increase of the functional positive correlations. Then the final conclusion is, this is the first demonstration of brain function disrupted by chronic pain. The brain of a chronic pain patient is not simply a healthy brain processing pain information, but rather is altered by the persistent pain. And so the longer we deal with this pain, the longer we let it go, the more it changes our system. And the more, in order to truly solve it, we don't just have to get rid of the insult that's in the periphery, now the brain is changed and rewired. We have to get rid of that problem too. We have to rewire the brain. Imagine all of the functional problems that relate to chronic pain, and we see this in our world with the radical increase of pain specialists who are giving medications that dial down the sensation of pain, but those signals keep on going. Because they keep on going, they keep on remodeling the brain. And because they're remodeling the brain, they're creating an abnormal impact on the entire system. Then, the most recent coup de grace with President Obama taking away opioids, which I'm not necessarily for or against opioids. I'm for the wise use of anything, any medication or surgery or whatever. But he wants to automatically just start taking it away. Well, here's the other issue, because opioids are an immunosuppressant. Many of these patients have already degraded their brains to the point where they have an autoimmune disorder and don't even know it. And they're being suppressed by that immune system problem is being suppressed by the opioids that they're taking. So once we take it off, they have a chronic pain problem that the opioid won't be helping, but they're all of a sudden going to have a raging autoimmune disorder, which is now going to institute or introduce a new level of inflammation that the patient didn't have because they can't suppress it. And so those are some of the kind of things that we deal with. And with those kind of patients with autoimmune disorders, we're working botanically to take those down. We're working to drive the brain, to get the brain so that it will operate that immune system at the level that it's supposed to and stop killing your body. So excellent questions. And if you have any more, let us know. We can expand on this or go lateral from it if you have any questions after watching this video. Thank you.